Hello everyone, and welcome to the Science North podcast, Give Vaccines a Shot, where we'll explore the latest in vaccine science, learn about the global pandemic we're experiencing, and learn more about our immune system. We will be doing all of this through the lens of our guest experts. This month's expert is Dr. Julia Orkin from the SickKids Hospital in Toronto. Dr. Orkin is a pediatrician at the Hospital for Sick Children in Toronto. She has been the pediatric medical lead for their COVID-19 outreach program. We will be discussing their COVID-19 vaccine consult service. The consult service is a by-appointment phone service that provides safe, judgment-free information about COVID-19 and vaccination. In our conversation together, she will speak about the importance of this service and the kinds of questions SickKids staff address. Welcome, Dr. Orkin.
So you work for SickKids, and we're here to talk a little bit about the vaccine consult service. So are you able to sort of explain a little bit about the history of SickKids and also what the vaccine consult service is?
Yes, so SickKids is a tertiary care hospital situated in Toronto. We have a large reach across the province and even the country for specialized care. As we recognize the need for education, support around vaccination, we partnered with the other children's hospitals across the province and the Ministry of Health to develop what we call the Vaccine Confidence Program. The Vaccine Confidence Program was developed to really support individuals, youth, their families, to have a one-stop shop for their questions, concerns, and an open forum that's judgment-free for discussion around the COVID-19 vaccine. We saw that there was many individuals that had important questions, whether that was related to the science, the evidence, whether they needed more time to ensure that the vaccine was right for them and or their child, and potentially they needed an opportunity to really just voice concerns. And so this was developed in order to have a one-on-one opportunity for consultation. The first step in the consult line is you meet with a nurse. It's a 45 minutes as the length of time if you need that to talk to the nurse. It's a self-booking process, so you don't need a referral from a physician, and that initial consult takes place. From that moment, you then go on to a further consultation if required. So let's say you call the nurse, you have a few questions, your questions are answered, you can end the call at that moment in time. If you have further questions that may be more medical about you or your child, that's more personal, you then can be seen by a nurse practitioner or a physician to have further consultation. And it truly has been an incredible opportunity to support individuals with decision making across our province.
What has the uptake been since you've launched this program?
Yeah, we launched in mid-October, and so we've had over 1,000 calls. We're actually over 1,500 now. The majority of calls are parents. We do have the opportunity for youth to call themselves. And the questions and the reasons for calling are hugely diverse. I think that the first thing is that, people need to have the opportunity to be able to sift through what's out there. When you see on social media, in the news, through peers, family, friends, there is so much information coming at individuals, and that parents really do want to do the right thing. They want to have the correct information. They want to make the right decision. But how do you do that when there's so much, noise in the background? And so what we initially had thought and what really has panned out is that the majority of people are calling for information. Many of them are very well educated, or they have done a lot of reading, and they just need that validation, that expert to say, yes, what you've heard is correct, or yes, this is what's, our recommendation, or this is what's likely. And then the second group of people that call are often those whose children may have an underlying medical condition where they may have a little bit more questions or hesitation around the decision for vaccination because of whatever their child's underlying condition may be. And that is a perfect reason to call, because we have the ability to access medical resources and supports to answer their questions. And we often will partner with a specialist team if required to get a more nuanced answer for the family. And then the third group of people who call are often those who call who may need more accommodation for the vaccine itself. They may have a child who has a real phobia or fear of needles. They may have a child who have developmental concerns or autism, whereby the administration of vaccine in a large setting may be challenging. And we can partner with all the local public health units or specialized children's hospitals across the province to ensure that if there is a appropriate way for a child to be vaccinated, that we can ensure that that occurs. And then the last bucket are really those who may have more concerns because of a previous reaction or maybe a COVID-19 infection, and they have real questions around when, timing, dose, that may be appropriate for their child. And so those are the biggest buckets. And the key thing, I think, is that it's really a non-judgmental space. It is open for discussion. Our nurses are trained in motivational interviewing techniques, and it's really just a conversation. And often what we do see is, in terms of, how do people hear about our service, or who initiates the calls, it's often actually recommended by their physician. So they may have already gone to their family physician or pediatrician to talk about these concerns. They just need more time or more expertise to really walk through it, to make sure at the end of the day that they know that their decision for their child is the right one. And what we can say is that when we look at our outcome data, which is, what we use as a metric for success of our program, that over 80% after our conversation with us describe an intent to go forward with vaccination. So that really there's a high, what we would say, success rate in terms of the importance of education and time in walking through this decision with families, weighing really the risks of COVID-19 virus being far greater than any risk of the vaccine itself.
So you were saying that the parents or whoever calls for the consult they don't need to be referred to by a doctor.
Yeah.
Are you finding that there are doctors that are referring their patients to you as well, though?
Yeah. So what we see is actually doctors give the families the link or the consult line website. And so when you go onto the consult line website, there's all sorts of information in and of itself. So our most common questions, we develop and put them into an FAQ document. So anyone can log on to aboutkidshealth.ca. So www.aboutkidshealth.ca, and that's the SickKids educational website. And we have a COVID-19 vaccine educational website or page. And that's linked directly to our SickKids Confidence Line booking. And so the first step is really, here's the education, you can read it yourself. The next step is make an appointment and talk to one of the nurses around your questions if the FAQs do not answer it. And so we do see a lot of physicians suggesting that an individual reach out. And what I know, and I hear from my colleagues, and I've experienced it as being a physician on the other line of these calls, is that often the questions that families are asking are really challenging, and they're good questions, and they're around science, interpretation of data, evidence, or side effect and risk. And for each physician in the community to stay up to date with all the literature can be challenging. So to have a support system or mechanism to suggest for your families to call, like a specialist referral, has been a really successful route. And we've gotten some really good feedback from primary care and other specialists who may not have the time to read through every single research study around COVID-19, but that's exactly what we're here to do.
So speaking of the questions, I have a list of some of the prescient questions that maybe you could answer right now. So what I'll do is I'll read out one of the questions, and then we'll get your answer for that. So
Sure.
The first one I have here is the second dose necessary after having already been infected by COVID-19?
Yeah. So one thing that we do see is often trends in questions. And so this was a hot question that happened after the Omicron wave, sort of mid-January, when the 5 to 11 vaccine campaign had really sort of launched, and then a huge wave of COVID-19 occurred. And so many children were unfortunately exposed or potentially infected with COVID-19 virus, and then families weren't sure what to do for vaccination or going ahead with a second dose. And so what we do know is that an individual's body's immune response to infection itself is not consistent. We don't know what you individually may do after COVID-19 infection in terms of your viral response, your antibody response, your ability to fight infection. And so right now it is very strongly recommended that you continue with the vaccine series and get the second dose to ensure that consistent response to COVID-19, to ensure long-term protection in a stable way rather than relying on natural immunity alone. We do know, however, that waiting until you're firstly over your acute infection, no longer symptomatic, and at least 8 weeks is the recommended time interval between COVID-19 infection and COVID-19 vaccination itself.
So, and then that was one of the questions, was how long to wait. So you recommend waiting 8 weeks
Yeah,
after the infection?
that's right. So we have national guidance that's extremely helpful. The National Advisory Committee for Immunization, that NACI guidance, as well as the Ministry of Health provides guidance in terms of vaccine intervals, timing, dosage. And so right now, the recommendation is initially to wait 8 weeks between your COVID-19 infection to go ahead and have your COVID-19 vaccine, whether that's your first, second dose, or otherwise.
Is that a similar interval between if they're having their first and second dose as
Yes,
well?
exactly. Yep, exactly. And the reason is that we want the body to be able to produce enough of an immune response to that vaccine. And we know from the research trials to date that first and then second dose with the adequate time interval produces a good immune response for COVID-19 protection.
So another question is, should I vaccinate my child if they have an underlying medical condition?
Yeah, so this is one of the really common questions that we get. And so parents are trying to weigh out risk and benefit. And so what is very clear to us is that the risk of COVID-19 infection, if you have an underlying medical condition, for severity of disease, for hospitalization, is higher. So if your child has an underlying condition, you're more likely to require further supports if you get sick. So for example, if your child has a condition that puts them at more fragile, with any viral illness, you're more likely to require admission to hospital, whether that's influenza, not only COVID-19 infection. So protection for your child is extremely important. And protection, one way of doing that is by getting the vaccination. Other ways, of course, wearing a mask, hand washing, screening, self-screening, and being conscientious around your decisions or your social interactions obviously help as well as getting the parent vaccinated. We know for many children, especially those who are under 5, who are not yet eligible for vaccination, we encourage something called the cocoon approach, whereby the parents or those that are close in connection to the child are vaccinated, therefore creating a cocoon effect around the child, especially those children who may be more at risk if they were to become unwell. However, we do know that otherwise healthy children also can unfortunately have consequences of COVID-19 infection itself. That may be immediate, such as dehydration, fever, respiratory conditions requiring hospitalization or emergency care, or long-term sequelae, such as multisystem inflammatory conditions. So that's an immune response that occurs after a COVID-19 infection, where your immune system goes into overdrive. And we see that often post-COVID-19 infection. And then, of course, long COVID or brain fog, which we're learning more and more about in children. And that we know that the COVID-19 vaccine actually protects not only against that acute viral COVID infection, but actually protects against multisystem inflammatory conditions. So it actually protects against both the acute as well as the post-acute or the after COVID-19 immune response. That is a risk for children and can cause severe hospitalization, morbidity, or negative outcomes. So it really is important to understand not only the risk for you, yourself, your child, your family unit, but also then to take it to the next level to say, what is the risk to my community? So is there a benefit to vaccinating my child for the greater good of the school or the greater good of my family? And the answer is yes. We do know that those who are vaccinated are less likely to spread infection. And that is really important from a public health perspective, not only a personal perspective.
Questions about side effects are probably very common as well too. So you probably get questions about the short-term side effects, and very often, as a science communicator at Science North, we're often hearing about, we don't know what the long-term effects of the vaccine are. Do you have an answer for those?
Yeah, I think the most important thing in terms of side effects, we can start about short term in terms of and long term. So we have information from the research trial, so the published data on the short and longer term side effects for children and youth. The most important thing I think in terms of short term side effects is it's actually really important to communicate what people may or may not expect. When you actually know what may or may not occur, you can actually help decrease your anxiety or worry around the vaccine itself. The first thing is that the majority of children and youth in the research trials to date and through the population, millions have been vaccinated now, actually have no side effects. That's the most important thing, that no side effects is actually the most common side effect. The second thing is that allergic reactions are extremely, extremely rare. And so we really try to express that, and that we have mechanisms in place to monitor for adverse events or possible concerns regarding COVID-19 vaccination. And these things are in place to ensure that we are adequate in our safety and monitoring. In addition, for the common side effects, usually there are things that are self-resolved and that parents actually know these side effects from other childhood vaccinations. So pain, redness, swelling on the arm where you got the shot. Sometimes the next day you may be tired, headache, muscle aches and pains. And actually, fever in and of itself is quite rare, but is possible. And then the next question that usually comes from the short-term side effects is, well, what can I do about that? And really over-the-counter medications, taking a Tylenol, stretching, and just providing overall comfort can be enough. Sometimes I say, put a cold, cool, wet washcloth over the arm and actually use your arm. Many children we see kind of like don't want to use their arm for the next 2 days. They're worried, but actually moving your arm can be very, very helpful. And then in terms of, other more severe side effects. So firstly, the question that we always have about allergies. So really, that is extremely, extremely rare. There are reported cases of allergic reaction, and whether that is something that is related to the COVID-19 vaccine or not is often investigated by an allergy specialist. As well, there's questions often about myocarditis and pericarditis. So myocarditis is inflammation of the heart muscle, and pericarditis is inflammation around the sac that holds the heart. And we saw that in the 12 plus age group, that with first the more likely Moderna vaccine, less likely Pfizer, but in the 12 plus age group, there was an increased signal based on the significant reporting data we have across the US and in Canada. There was a signal that there was a concern regarding myocarditis and or pericarditis after the COVID-19 vaccine itself. What we've been able to really learn since that occurred is, firstly, you're actually much more likely to have a myocarditis or pericarditis diagnosis after COVID-19 infection. So you're actually 16 times more likely to subsequently develop myocarditis or pericarditis if you have COVID rather than the COVID vaccine. In addition, if you're 5 to 11, so the younger age group, the likelihood of myocarditis or pericarditis is extremely low. So we really do know that there is a theoretical risk based on the 12 plus and based on some of the learnings. We are now recommending the Pfizer vaccine for the older age group for 12 to 17, which can decrease the risk. And that really, those children who did unfortunately have a condition of myocarditis or pericarditis, the majority did not require hospitalization. It was self-resolved and really only required over-the-counter medication such as ibuprofen. So it's a very self-limiting and non-severe condition. So this is information that's important for parents to know, and that they can actually find real-time stats on this on Public Health Ontario websites, in the US, on the CDC website, Center for Disease Control, because it's really important that parents do have the correct information in terms of the incidence or the likelihood of any of those conditions actually occurring.
And then how for long-term effects, like usually how long is a long-term effect for a vaccine? Like from what I've been hearing, it's usually 2 months is usually sort of the extension there.
The mRNA vaccine technology is actually very cool. Sometimes people use the analogy, it's like a recipe. So, you look up a recipe, you look at a recipe, you make the cake, you keep that paper around for a couple of weeks, and then you forget the recipe. And so that's what it is, really. It's 6 to 8 weeks, let's say, on average. And basically you're giving your cells a recipe to create a fight or a response to COVID-19 virus. And then that recipe, the vaccine, being the recipe, is then erased in your body. So the likelihood of long-term side effects past a few months is absolutely unheard of with the mRNA vaccine technology. And so really that is not something that we are seeing. Once again, the data is being monitored. Individuals are being, appropriately concerned. But once again, that is not something that we as a medical or scientific community has evidence or reason to believe that there would be any long-term side effects based on the technology of the vaccine itself.
Do you have this program was brought about because of the COVID-19 pandemic and this new what we're calling a new vaccine technology. Are you planning to expand the service or keep the service going on for other vaccinations and other consults?
Yeah, it's so interesting. To be honest, when we launched, we weren't sure, like, what would be the majority of calls or what would people be, concerned about. There is a huge bucket of individuals who have had challenges with vaccines in general, not necessarily because of true hesitancy, but challenges with whether that's administration due to the child having severe fear around vaccination, or potentially due to concerns regarding the child's ability to understand that, why do they have to be held down? Why do they need to hold my arm if you may have an underlying neurodevelopmental condition? And so we've actually been able to pair the vaccine consult service at the hospital for sick children with a specialized vaccine delivery program. So there's a few techniques that we can put into play. For example, they have an initial consultation with our nurse practitioner. If they've called the vaccine consult line and there's an accommodation concern or a phobia concern, they then meet with our nurse practitioner and they map out the whole day. We work with psychology, our child life specialist, and we actually can provide a specialized vaccine delivery opportunity, whether that's getting the vaccine in their car, that's coming into a hospital is scary to them, whether that's having our child life specialist, music, virtual reality, goggles. There's tons that we can do. We had pet therapy come. And so that the actual experience of getting the vaccine in and of itself can be child-centered and focused. And so that, I think, is learnings that we're not going to lose. We had many children who have gone to, multiple attempts at vaccine and have been unsuccessful. And then it starts to affect their self-esteem, their ability to engage socially, their ability to do recreational activities. And so by being able to understand not only information, scientific questions and concerns, but actually accommodation and vaccine delivery opportunities has really changed, how we've looked at it. And I think that we would be hopeful that we could take some of those learnings and apply it broadly across the board.
Excellent. Such a great service. Before we finish off, would you like to describe what your favorite part of your job is?
Sure. I mean, I can tell, going back to the accommodation, getting letters sometimes from families to say, we were so nervous about getting the vaccine, or we really were unsuccessful. And thank you so much. We were able to have our questions answered, our concerns addressed. We were listened to, and then we're able to come the very next day, get the vaccine, and seeing the smile on that child's face and the family knowing that, they were able to walk through their process. There is absolutely nothing wrong with having hesitation, questions, concerns, or wanting to know the most that you can about a healthcare decision for your child. That is really the role of a parent. And by being able to offer families the ability to really get down to the nitty-gritty, if that's what they need to make the right decision, it's been a complete pleasure to be a part of some of the journey as myself as a physician, and I know as our whole team. So it's been truly wonderful. And we're looking forward to the under 5 vaccine approvals, because we know there's a huge second or third wave of children who really do need our support. So we're looking forward to that over the coming months.
Do you have one essential message you would like to leave us with?
I think the essential message I would like to leave, you or the community with is that, although COVID-19 infection in children can be mild for many, it can be severe for others. And as a pediatrician caring for hospitalized children with COVID-19, I can say that loud and clear. And that really, based on millions and millions of children receiving the COVID-19 vaccine and seeing extremely little, almost no side effects in the majority of individuals, that the risk benefit is really clear. And that if having a conversation with our vaccine consult line or your primary care provider or another trusted individual allows you to move forward in your journey of making a decision around the vaccine, I urge you to seek out that information in order to ensure that our children are kept healthy, kept safe, and that actually be able to be back in school and doing all the recreational things that they're meant to do as children.
Thank you so much for joining us on this podcast, and thank you so much for your expertise. It is greatly appreciated.
Thank you so much for doing this. We really appreciate you.
Thank you so much for listening. We also want to know if you have any questions. If you have questions about this episode or questions about viruses, vaccine, or the immune system in general, please send them to vaccines@sciencenorth.ca. We'll be addressing those questions in future episodes. If you want to find out more about this campaign, please visit sciencenorth.ca/givevaccines a shot. Please follow us on Facebook, Instagram, and Twitter. If you're watching this on YouTube, be sure to like and subscribe. Lastly, Give Vaccines a Shot is funded through financial contribution from the Public Health Agency of Canada. The views expressed herein do not necessarily express the views of the Public Health Agency of Canada.